I hope you're all having a really good day. This is another quickie as I'm trying to prepare for a webinar that I'm doing for functional medicine. You know, every day I see things and I'm listening to patients, and there are things that I gather through my research, through my clinical experience, that I think it's important for you to hear. One of those things is how prostate cancer can be actually a blessing from the skies. And then, of course, you're looking at me and you're saying, how can a cancer be a blessing? That's the most ridiculous thing I've ever heard. All right, I get it. However, most people, and I do understand, I mean, I hope you understand that I understand that that cancer can, of course, be deadly. But the fact of the matter is that most men with prostate cancer don't necessarily die from prostate cancer. They're dying from other things. Heart disease, #1 killer. They get prostate cancer and then they die from other cancers. Bladder cancer, it could be unrelated to prostate cancer. They develop Alzheimer's. You know, they die from anything, all other kinds of things, not just prostate cancer. Now, this is not to say then, because of course then one can take this message and say, oh, I'm never going to screen for prostate cancer because people don't die from it. That's not what I'm saying. What I'm saying is that once this diagnosis occurs, then this is an opportunity for that man to reevaluate their lives. This is an opportunity. See, let me put it to you like this. Men don't care to be healthy. Okay? Men don't want to be healthy. That's not their primary goal. So thus, men don't go see doctors for prevention, or, I mean, they should, but it's just not how men are wired. Men care only to perform. And if their disease interferes with their ability to perform, then now they care about their health. I know, it's ass backwards. It's not the right thing. It's not the right way to look at things. I would love for men to do more preventative things and go for office visits that, that are more related to prevention of disease and cancer, but it's just not how it works. I would love for my clinic to be filled with men looking for prevention before they're diagnosed, but it's just not how it works. Going back to the prostate cancer topic, which is the intention of today's video recording. Once there is that diagnosis, then men start taking action. Once there's that diagnosis, then since you are confronted with your mortality, probably for the first time ever, you care to be more proactive. You reevaluate your life. You reconsidered what you value. You reconnect with people that you need to reconnect with. Maybe those are friends, maybe that's a family member, maybe that's your kid. All right? You just look at life differently after that diagnosis. Why? Because that diagnosis is the C word. So once you say the word cancer, there's certain images that just pop up in your head, horrific images that you've seen from either other family members or on TV, or in videos, and, people undergoing chemotherapy, wasting away, and so forth. Again, while prostate cancer is a potentially deadly disease, in most cases is not. Particularly in most cases where certain lifestyle practices are applied. I talk a lot about the capless method, which is a systematic method of living, a lifestyle that's specific for men who've been diagnosed with prostate cancer, something that I was able to develop. But whatever lifestyle, you know, you change your lifestyle, you change the way you view things, your mindset changes. It's actually pretty remarkable. Today I saw a great gentleman who's probably, I saw a gentleman who is probably watching this video. Great guy, really cool guy. He was diagnosed in 2013 with prostate cancer, and then in 2015 his subsequent biopsy was negative for prostate cancer. So is he cured from prostate cancer? I don't know. I like to think so, but I'm biased towards lifestyle and natural medicine, so I like to think so. But I have to also be objective. The bottom line is that at this moment in time, there's no need to worry about prostate cancer. So we were having this discussion, and he's going through some life challenges, and he's saying, look, once you're diagnosed with this disease, almost nothing else sort of matters. You take on life occurrences in a different way. Prostate cancer diagnosis kind of makes you, gives you that wake-up call that men need. And so I'm going to end with this. Here's what I'm going to end with, and here's the takeaway. Obviously, no one wants such a diagnosis. This is a no-brainer. And yes, some men do die from prostate cancer. For most men, by and large, prostate cancer diagnosis is not a death sentence. And I see everything prostate cancer, so it's not like I'm seeing guys with low-grade prostate cancer. No, I'm seeing also guys with, advanced prostate cancer, even those that are metastatic to the bone, and even those guys are doing actually phenomenally well. And talk about reevaluating your values. These guys do it. So the takeaway is, if you've never been diagnosed with prostate cancer, act like you've been diagnosed with prostate cancer. Why wait? You may get it anyway, because most men who have a prostate intact will eventually get prostate cancer to some degree. Why wait? Start now. Start now. Take care of yourself now. Visit your doctor, particularly if they practice natural medicine, holistic medicine, now. Why wait? Oh, well, I don't have time. Don't give me that BS. The I don't have time excuse. Because trust me, men make time after they're diagnosed. That's BS. So one of my overall goals is to change that mentality, to change the way men look at health, hopefully to understand that we should be, yes, we should produce, we should be productive, we should provide, we're providers. At the same time, in order for us to do so effectively and efficiently, we need to be on top of our game, mentally and physically. Okay? And in order for us to do that, we need to take good care of ourselves. We need to, look, I just got my, where is it? I did a genetic test for, here it is. I did a genetic test called a color genetic test for cancer. I want to know what my risk is. So one of the things that I think you should consider is doing a genetic test to see what you're predisposed to. And from a cancer perspective, it showed that I am, thank goodness, I have no mutations for several cancers. Stomach cancer, prostate cancer. Although I do have a family history, my grandfather, my uncles from my father's side, according to this test, I have no family history. So genetic testing is important in my opinion. Takeaway. Don't be foolish. Don't be a typical retarded dude. Don't have the excuse of I don't have time. You have time. You have time to whatever it is that you value. Just like you have the money to pay for whatever you value. When people say, oh, organic food is so expensive, my God. Don't give me that. Don't give me that. Don't give me that. You know you spend a lot of money on crap. You like your nice bottle of wine that costs like $80 or whatever. You take trips. Don't give me that. Don't give me that. So make no excuses. Train hard. Physically train your body to avoid or at least reduce the risk of these conditions. Physically train your body to not die prematurely from disease. Obviously, I don't know if I leave this building today and something, so a piano hits me in my head and that's it. I have no control over that. But you have control over more than 90% of the state of health that you're in right now. And reduce your risk of a diagnosis like cancer or like anything else. Take action. And if you've had prostate cancer, life is not over. In fact, life is just beginning for you. Live your best life now. Take this opportunity to live a better life now. Okay? This is my experience. This is my research. This is what I see clinically each and every day. So this is not hyperbole. This is not, oh, of course you would say that you're a natural doctor. This is real and this is science. Make it happen. Make it happen. I hope today's video post is helpful for you. Let me know. Thumbs up, thumbs down if you don't like it. And let me know if you like more. If you want more, let me know. Have a great day. Have a great weekend. This is Dr. Geo signing off. I hope you have a great, fantastic, and lovely day and weekend. Talk to you soon. Bye.